My name is Sarandra. I'm on the Tucson campus, and the shadow I did was for the P4 block. It was with the Banner South inpatient psychiatry setting. It was a short-term setting, so patients who get admitted to the hospital and end up being placed on a psych hold, they'll be there sometimes for a couple weeks to about 3 months, and after that they end up going into sometimes long-term care facilities, or they just get discharged. It just kind of depends on treatment and how the patient's doing towards the end of their release. I shadowed the P4 student Brianna Mendoza, and her preceptor was Melissa McCrary. It's a pretty neat setting. I feel like I kind of learned a lot and kind of what we're gonna have to be needing to know if someone was to go into that profession. It's a Monday through Friday job with rotating Saturdays once a month. The rotating Saturdays once a month, it's just to be the on-staff pharmacist for the hospital, and the Monday through Friday, that's going to be pretty much their desk job in the psych hold. And it starts about 7:30 in the morning, and then it'll end about 3 or 3:30. Pretty early, and it's kind of neat. They have lunch and it's actually like really well organized the way their schedule happens. They'll get there in the morning, and the pharmacist, she reviews changes and she'll identify major changes. And the P4 student, she gets assigned a group of patients, which is just depending on the doctor. Sometimes different doctors are assigned like about 8 patients, so she'll follow those for her time there. And with the patients, she catches up on whatever happened throughout the night from the day before or from the Friday before if it's a Monday. And this includes food intake, med intake, behavioral activities, any labs that were done, because sometimes patients refuse lab work. So they'll have a request pending for several days or a week, and they just haven't gotten any updates, and they'll keep requesting it or see if it's been acknowledged by the lab team. And they actually even monitor like any bowel activity, like bowel movement and using the bathroom, so urine as well. So what this does, it's gonna help them prepare for rounds. So after they catch up on the patients from the previous day, they will end up going around with the doctor that they're following, and the pharmacist doesn't directly interact with the patient, but they're standing in the back and they're as well observing and listening. And what happens is they'll observe, and then after they meet with the patient, the whole healthcare team will have a huddle after in their conference room, and at that point the pharmacist will share what they believe needs to be adjusted, or how we can better manage the patient's healthcare at this point. And it was kind of neat because while I was there was a patient that ended up bringing about the conversation of mushers and pushers, which we have learned so much about. So that was pretty cool. I was excited to see how something we currently learned is actually happening and it's being used. And I was even like, oh my gosh, I know the answer to this. So that was pretty cool. And just so you know, it's that opioid-induced constipation. So aside from knowing psych meds and their interactions, you have to understand like safely increasing doses and what happens when you're increasing those doses. So that's kind of cool. Kind of made me think about things that we need to focus on throughout our education these coming years. And they also, for this job, you do need a PGY1 and PGY2. It kind of just depends on where you end up working and what site has it available, because sometimes PGY1s are offered, but then a PGY2 won't be offered. So it just depends on if you're willing to relocate. And Also, if there's openings, the current pharmacist there, Melissa McCrary, she said she had applied to Banner South from, I forgot where, but she didn't go to school in state and it was kind of far away. So she applied at Banner South. She did her PGY1 there, and she was just kind of working everywhere. She was working in the ER, in just the inpatient and the outpatient, and just kind of floating around everywhere. And they kept sending her up to the psych floor, and she ended up sticking to it. It wasn't her first choice. She didn't really know much about it, but she said it's pretty fun. I will say it's kind of a little boring, I guess, towards the end. So throughout the morning, you're learning about your patients, you're observing, you're working with the team, and then you break, you go to lunch. After lunch, you end up charting. So that's just like updating what regimens are going to be changed, if any, and even how to encourage a patient to take Miralax, or how to take Miralax, or explaining to them the importance of having bowel movements. And that was kind of cool. They kind of do little things like that. But so after the charting, they'll end up having a hospital huddle. So we had to go all the way down to the hospital pharmacy, and it was just all the pharmacists in the hospital met, and it was about 30 minutes, and it's just kind of talk about any updates on medications. That way everybody's in the know. And after that, they part. So that's kind of about it. And then they finish up their charting and they're kind of done for the day. But the charting, you're kind of just sitting at your desk alone and not doing much. So I was like, I don't know. It's kind of sad with not really a lot of patient interaction, I guess, because that's what I'm used to. And that's what drew me into pharmacy a lot, was being able to be there and interact with the patients. And throughout the P4's time with the psych pharmacist, she was assigned projects. And a project actually that I was there for, it was just her getting together some information, and she ended up presenting depression. So this is like the little guide she put together to present, and she presented it to her preceptor as well as a resident who was completing her PGY1 there. And throughout the presentation, the pharmacist would even ask her questions about the medications that are used to treat it. And so just really understanding this this mental disorder and being able to help patients who are diagnosed with it. So that was kind of cool. She kind of gets her little projects, and it changes what she expects her to know or what she wants her to present. And let's see, advice that the P4 gave me was that on rotation, if you don't know the answer, it is okay to say, I don't know, but I will come back with an answer for you. And if that's later on the same day or the following day, make sure you do your research and make sure you're ready for any follow-up questions that they ask you, aside from the one that you're already providing an answer for. I did ask her if she wanted to do this, and she said no. She had previously done a rotation with emergency pharmacy, and she said she really liked it. She liked how quick it was and the way she was more involved in the patient care, and it wasn't just adjusting a doctor's prescription or making the recommendations. They were more involved directly, so she really liked that, and working bedside with them. And yeah, she said never be afraid to be wrong, and make sure you ask for clarity. Don't make assumptions, because we can end up making misinformed judgments depending on the patient's diagnosis. I even asked her just kind of about school, like any advice for school. She said, be proud of your journey, all the little steps that you take, the small wins. Be proud of yourself, even if your end goal is the bigger picture. And that kind of hit close to home for me, because I kind of think about, well, this is just something little, and it's not even the end of the semester. So I'm like, if I could get to the end of the semester, I'll be okay. And she said, every rotation, every single one, be ready and willing to learn and want to learn. You need to ask questions and don't feel like you're drawing blanks. You need to feel like you don't know. Just say you don't know. That way you get more. Even if you maybe know an inch, and say you don't know the 5 inches. So ask, and always do that. I don't know if I would be interested in practicing with this area pharmacy. I think it'd be really neat to do an appy rotation at this site, just because there are different floors that they have. So there's like the one for kids, and then the one just for adults, and then they have so that's like the short term, and they end up having the long term for adults. So I kind of want to be able to explore that a little bit more. I think it's pretty neat. Like, people either go in because it's drug-induced mental disorders, or they're just chemically imbalanced that way. So everybody kind of has their own little tweaks that you gotta make. Yeah, I don't think I'd really be interested in this pharmacy, just because I think you're not directly interacting with patients, and you don't have those conversations with them that make you feel like you're making that difference. Like, yes, they see the progress that a patient makes with their time there, but I don't know if that's actually something I feel like would be fulfilling. And yeah, it was pretty fun. I hope if anybody else goes on a rotation at this site, you get a little bit more insight than I did, and share it with us. Bye.